I've already touched on some linkages to population health. I can't help it, sorry, but we're going to dig a little bit deeper into population health now. So really, in terms of defining it, when, you know, population health, when we think about population health, we're focusing on collective health. So collective health of or illness in different populations or subgroups within a population. So really that is in contrast to when we're looking at the health or illness of an individual. So if you were to try and define population health, you know, in one word, or let's say two words, I think collective health for me really contrasts it with or against that of an individual. So you can either look at individual health, and often as clinicians, that's what we are focusing on, rightly so. But, you know, in this unit in particular, we're kind of stepping back and looking at the big picture. And that'll make sense a little bit later in this lecture when we kind of look at an analogy for thinking about population health and health promotion. You know, when we look at the health of an individual as a clinician, we're one-on-one, and we're really looking at illness or pathology that's already been caused. And as we move upstream and look to try and prevent it, then that's when we look more at populations and think, well, how can we have population level interventions that prevent and reduce the number of individuals that we need to work one-on-one with? That's essentially why we look at population health from a nursing perspective. So examples, this will just really lay it out. I've already touched on these. So national health, if we look at the national health agenda, that's certainly the federal government's remit, you know, in terms of the federal government collects our taxes that we pay, our income tax, and that they are responsible for, you know, having oversight in terms of how do they ensure that we can have a healthy lifestyle. Look at Medicare, for example. We'll touch on that a little bit later. So we start with the Australian population, national health. We can look within that population and look at Aboriginal and Torres Strait Islander people's health. So I mentioned before, Indigenous population versus non-Indigenous population. We can further break down into subgroups of men's health and women's health. Then we can look at older person's health versus child and adolescent health, and maternal and infant health. So, you know, starting from the total Australian population, we're able to break down into several different subgroups within that population. So let's look at some examples. These are examples of, I guess, health promotion and education campaigns which are providing some stats here. So men's health facts. So looking at lifespan. So men live short, you know, it's got numbers here to quantify, but in general, we know that men live shorter lives than women generally on the whole. Men are more likely to die from heart disease at an earlier age. Men are at a higher risk of dying from liver disease than women. Spinal cord injuries occur in young men more so than women, and you've got to look at behaviour, you know, more risk-taking behaviour, more different aspects of lifestyle, which kind of might link with that. Diabetes, so men have an increased risk of dying from diabetes. So cardiovascular disease, suicide, and motor vehicle accidents are the top 3 reasons for reduced lifespan in males. Workforce fatalities, you know, so men are overrepresented. They're 94% of workforce fatalities are male. And yes, I mean, this is despite making up only 56% of the workforce population, 94%, you know, workforce fatalities are men. So that's a definite overrepresentation there. Yeah, so look, this is a kind of public awareness education campaign, and you can see that you know, this pitch here that only 30% of males' overall health is determined by genetics, and that, you know, being male is not an excuse for unhealthy lifestyle choices. Let's look at women's health. So February, if you didn't know, is actually Ovarian Cancer Awareness Month. This is the hashtag here for last year. I'm not sure if it's running again this year, but you could check it. Ovarian Cancer Australia have a number of these kind of resources which they distribute through social media to raise awareness. So this is one of them. So again, risk factors is one of our one of the things we need to be aware of, because we can't educate patients, families, communities. We can't educate them on how to prevent things like cancer unless we know what the risk factors are, and then we can communicate those to help people, you know, change what they're doing in terms of minimizing their risk. So, you know, their kind of slogan here is, it's time for action. Similarly, symptoms. So we're going to talk a lot about health literacy down the track. So if patients, families, other people in the community don't know what the symptoms are, then how are they going to be able to actually prevent or manage their, you know, prevent illness or manage their health? So again, this comes back to us. We need to be aware of these things in terms of symptoms, signs and symptoms, so then we can provide education and support. Support people in preventing and managing cancer. So, you know, there are a whole lot of different population health interventions that we might not have even realised what they are. And so look, if we think about some of the obvious things that we take for granted every day, and just look at those through a lens of public health now, or population health. So I mentioned Medicare before. So, you know, we might have grown up with that, just taking it for granted, but, you know, that is one population health intervention at a policy level, which relates very much at a practice level as well, when you get your Medicare rebate, or you only, you know, in terms of gap payment and things like that at the GP. So this is where our taxpayer dollars are going to fund, you know, universal access to healthcare in terms of, you know, World Health Organization, one of their biggest international campaigns at the moment is about universal access to healthcare. And we're lucky that we have that here in Australia. In America, it's a very different story. Largely, you know, private health focus. So if you don't have health insurance, often you suffer for that. So things like access to clean drinking water, so water supply and sanitary waste disposal. These are things that haven't always been around. And because of things like population health, looking at the importance of sanitation, firstly identifying infection to water supply or lack of waste disposal to infection, then actually saying, okay, what can we do to prevent this? So these are, you know, these are all population health interventions that are in place that we might take for granted. Things like legislation. So, you know, there was a time when there weren't seatbelts, or there were, but you didn't have to wear them. There were no speed limits. You could drink as much as you want and drive. Things like secondary tobacco or smoke exposure. So these are things that there is now legislation for. So really, there are punitive measures in place as a disincentive. So if you don't wear seatbelts, if you speed, if you drink while intoxicated, you will be fined. There will be, you know, financial and or jail time kind of penalties imposed. So that's looking at a policy level, and we'll touch a bit more on that soon. Things like regulation of water quality and safety in public swimming pools. Have you ever thought about that? You know, that's actually a population health intervention right there, in terms of saying, hey, public swimming pools need to be at a safe standard, chlorinated, so our populations can actually swim in those safely without, getting gastro. Again, food safety standards. These are things, we go to restaurants, we purchase and consume food nearly every day, but have we stopped to think about the population health interventions at a policy level that are actually in place in terms of hand hygiene and food storage and food serving practices? You want to be able to actually confidently go and purchase food and consume it safely, knowing that without fearing that you're going to get gastro, salmonella poisoning. So I've already mentioned things like access to drugs like penicillin, antibiotics. So these are all current examples of population health interventions that we probably, take for granted or may not be aware of. And these are all things that have certainly contributed to the longer life expectancy that we enjoy now. So we've looked locally in the state of Queensland, but this just shows since, looking at the late 19th century into the 20th and 21st century. So there's a steady, you can see over a long period of time, a steady increase in terms of life expectancy for both males and females. Males are still lower than females. Not sure if that will change. And that's from the Australian Bureau of Statistics. So just digging a little bit deeper now, we looked at national health priority areas, and now we're going to look at priority population groups and then age groups. Because really it's just about looking at, well, where are the big issues, in which populations, in which subgroups, because then knowing that we can address them in tailored ways. So priority population groups in Australia, identified again by the Australian Institute of Health and Welfare. So Indigenous population, so specifically, Aboriginal and Torres Strait Islander people, all people in rural and remote areas. And think about that, it's about access, often, access to healthcare and infrastructure and supplies. Socioeconomically disadvantaged people, and we'll look at that a little bit more soon. Veterans, so looking at servicemen and women in the armed forces, prisoners, and any people born overseas, so migrants really. So I've mentioned this as well before. So roughly 10 years, the life expectancy gap between Indigenous and non-Indigenous Australians. So it's too high. It's we need to work on that, obviously, but we need to do things differently, I think. And this is same for males and females. So it's closer to 11 years difference for males, and well, actually, they're fairly similar, and they're both close to 11 years, really. 10.8 and 10.6 is the gap in terms of life expectancy. So looking at age groups now, so, maternal and child health, really, child and adolescent and older people, which, I've already mentioned before, is a growing priority. So, it may feel like I'm just rattling off different population things, but this will all make sense when it comes to thinking about, well, how do we promote health? How do we develop interventions or work with people to promote health? And we can't just, it's not a one size fits all. We need to look at someone. So even if we're looking at the individual level, we need to understand them within the broader social context. So, where does this individual, where does this patient fit in terms of population health? Are they male, female? Are they, a 90-year-old living in residential aged care? Are they from an Indigenous background? We need to understand someone in their social context, so then we can better help target and tailor interventions, which include things like education. So how are we going to reach and help someone? you know, the best way we can do that is to first understand them, understand who they are, and, you know, how they've, what's relevant to their health status. So national health priority areas, this is an expanded list from the earlier one that I showed you. That was 2005 data. So this is in order of priority. So cancer control, cardiovascular health, injury prevention and control, mental health, diabetes, asthma, arthritis and other musculoskeletal conditions, obesity and dementia. So these are the top priority areas nationally. Now, so looking in context again, so this, I've already covered these in dot points, but the, you know, the continuum of care from prevention through to treatment and management, this is what the focus of the National Chronic Disease Strategy is. So really, it's across the continuum. So trying to prevent chronic illness at a primary level. So let's stop people from getting skin cancer in the first place, through to treatment and management. So that's looking at more secondary prevention and tertiary prevention. And we're going to cover those definitions off in either this or the next lecture. So this is just looking at a breakdown in terms of, you know, cardiovascular disease, cancer, being the top two. I mentioned the DALYs before, the disability adjusted life years, that kind of epidemiology terminology. So this is old data actually, but it just shows the continuation really of a historical trend for cancer and cardiovascular disease in terms of topping the prevalence and, you know, our priority areas. Now, so I mentioned this before that I had tweeted something earlier today from the AIHW, and this is what I had tweeted a link to, and you can search for this online. Just you can Google it or go to the AIHW website. But this is speaking more. This is very recent. This is as of January this year. So again, looking at socioeconomic inequalities. So specifically looking at CVD, diabetes, and chronic kidney disease. So we're going to look in this unit about social determinants of health, because when we understand an individual within the population and look at what has caused or led to a chronic disease, you know, if we're going to educate and try and support someone to promote health, we need to understand causes and what factors are involved, because otherwise, you know, education could be just futile. So we need to understand that, you know, health as a whole, we tend to enjoy good health in this country, but it's not shared equally, as when we looked at closing the gap between Indigenous health and non-Indigenous health. So essentially what we need to understand that people's socioeconomic background, so their social status and their economic position in terms of society. So there's a general link with this in terms of health status. So there's a chart here looking at education levels. So just purely looking at education, you can see on the far right here, people with a bachelor degree or higher actually have lower incidence of diabetes mortality, or less people die from diabetes if they have, where they have a bachelor degree or higher education. And you can see that with the lower levels of education, the deaths associated with diabetes actually increase. And for these particular chronic conditions, diabetes, CKD, and cardiovascular disease, this holds true throughout, that generally, the higher a person's socioeconomic position, the healthier they are. So factors, really, the the take home from this slide is that factors such as income, education, employment and work, and housing or homelessness, so someone's physical environment, if you think about, things like Maslow's hierarchy of needs. So these things, we call them the social determinants of health. So things like your income, your education, your employment. These things are key factors in terms of determining what your health status may or may not be. So, social determinants of health are really important to understand because they have a big impact on the health of individuals and communities. So there's actually data, I will try and find it and make it available on the Blackboard site, but there is an AIHW tool where by postcode, you can search by postcode, and they've actually looked at different health status, health outcomes and health status by postcode. And, that's not necessarily about affluence. Income may be a factor, but, things like your location. So whether you live in a metropolitan area or regional, rural, remote, the further out you go from a metropolitan city, then your access to healthcare and things like medicines becomes lower. So those, your geographical location is also a social determinant of health. So like I said, it just comes back to understanding the individual within the bigger picture, their broader social context, because generally that social context has influenced or impacted on the presentation that you're seeing in terms of health status. So really just summarising everything that I've said, that chronic illness is a growing problem in Australia, influenced in part by an ageing population and multiple comorbidities. So 1 in 4 in Australia are affected by chronic disease, and many of those age 60 or over are estimated to have more than 2 chronic conditions. So like I said, there are more and more people living with chronic illness, and generally it's not just one chronic condition, it's multiple. And that has implications for us in terms of things like polypharmacy. So where you've got, multiple comorbidities, you're going to have polypharmacy. So it just gets complex. So really we can see, looking at this picture, looking at the trends in population, looking at the trends in chronic conditions, prevention and management of chronic illness are increasingly paramount, and it's just no surprise that you paint the picture and it's just self-apparent. So I feel like I'm telling you something you already know and understand, but I've just got to paint the picture as it is, and I'm sure you are already seeing the way it is and what needs to happen.